So we've touched on the stress piece here and the cortisol. What do we want to make sure we're addressing next?
So after that comes diet. And I think that in order to understand nutrition, you have to understand macronutrients, because a lot of women are going to their doctor and saying, I need to lose weight. And their doctor is completely dismissive, especially if they're postmenopausal women. Their doctor might even say things like, well, I like my women a little bit bigger, or I like you to have a little bit of reserve in case you get sick. A common response is, well, just eat less and exercise more. It's just all about calories in, calories out. Those are not true. Weight gain is not an inevitable part of aging. And it's important to emphasize that insulin resistance increases after menopause. Okay. So for women in this phase of life, it's super frustrating because they're like, I'm not eating or exercising any differently than I was 10 years ago, but now I'm putting on weight. Why? And so we have to address the fact that, well, how you were eating and exercising was working maybe when you had more estrogen in your system. But when your estrogen plummets after menopause, your insulin resistance goes up. And that's why, similar, you've had on the podcast before from Dr. Fung, he said a woman's risk of heart disease is lower than a man's until she goes through menopause. And that's because when that estrogen goes down, the insulin goes up, and that increases a woman's risk for heart disease. So if you have been just deluded by this eat less, exercise more notion, and you've lost the same 20 pounds 5 times in your life on various diets, just know that there's hope. And when you understand how to eat to keep insulin low instead of how to eat to keep calories low, the door is open. And as we've alluded, the beautiful thing about the insulin story is there's more than just one lever to lower insulin. Because in the calories in, calories out model, you have diet and you have exercise. But when we're talking about the insulin model, you have sleep, you have stress, you have diet, you have exercise, you have environmental toxins, you have medications. All these things can contribute to elevated levels of insulin and inflammation. So I wanted to lay that groundwork because I think a lot of people, when we come to diet and exercise, have a lot of skepticism that nothing's going to work for them. And that couldn't be further from the truth. So I wanted to start with a discussion of macronutrients, okay? Because I think your podcast is so good and you have the best people on here. But I think sometimes when people are so good at what they do, they forget to break it down into layman's terms and meet people where they're at. So with macronutrients, macro means big, right? Large amounts of nutrients. There's 3 primary macronutrients, 4 if you include alcohol, which I'm leaving out of the discussion. So carbohydrates, proteins, dietary fats. Those are the 3 macronutrients. Under the carbohydrates umbrella, there are 3 main types of carbohydrates. Okay, fiber. There's soluble and insoluble. I'm going to leave it at fiber for now. There's starches and there's sugars. Now, let's start with the starch. And Dr. Lustig on your podcast alluded to this, but in case people haven't listened to that interview, there's, a starch is not a starch. So there's amylose and there's amylopectin. Amylopectin. I remember that because it's a longer word, right? So there's more branches. Amylopectin starch is like a tree with many branches. And so the enzymes that digest the multiple molecules of glucose can do that quickly. So think white bread, white rice, white pasta. Amylopectin starches break down fast. And then the amylose starches, if you think of like a branch with one end, like 2 ends. So there's only 2 ends where those enzymes can break up that glucose. It's going to be digested slower. So I'm not going to get into a lot of examples yet. We can talk about some more nuances, but think like beans, lentils, oats, those kinds of starches are going to be more they're going to be digested slower. Okay. So the sugars, breaking down the sugars, the 3 main ones I talk about are glucose, which Dr. Fun spoke extensively about on the podcast, fructose, which Dr. Lustig talked on the podcast, and galactose. So galactose is like the simple sugar. All of those are simple sugars. One sugar molecule is a simple sugar, okay? Simple carbohydrate. So the glucose molecule is what is found circulating in your bloodstream. That's why it's called blood glucose. Okay, so the glucose molecule is what combines to form those different types of starches, either the amylose, which is the one with two ends, or the amylopectin. So that's why they say starch is just sugar, because it is. It's glucose, which is a simple sugar. Now, fructose is the type of sugar that's found naturally in fruit, or a type of sugar. It's the sweet stuff, okay? The problem with the glycemic index, when we're talking about diabetes, insulin resistance, eat a low glycemic index food. Well, fructose doesn't raise blood glucose, but it is still very harmful in excess for your liver. And so things like apple juice, for example, won't have as high as of a glycemic index, but it has a ton of fructose in it. Or things like honey and agave, these natural sweeteners that people are eating, have a ton of fructose in them compared to table sugar. So they're not benign by any stretch of the imagination, just because they're natural. So fructose, glucose, galactose. Galactose acts a lot like glucose. We eat it in much smaller quantities. So I think breaking down the macronutrients and then bringing it back together, right? So, okay, well, what is table sugar? Table sugar is one molecule of glucose plus one molecule of fructose bonded together. Well, what is high fructose corn syrup? High fructose corn syrup is a percentage of glucose and a percentage of fructose, but they're unbonded. So high fructose corn syrup will digest even faster than table sugar, which is why the pops and stuff like that with the high fructose corn syrup are terrible for our health. They spike your blood sugar so fast, and that shunts it to the liver. It's like a missile to the liver. And so high fructose corn syrup, sugar, if there's a really great chart online, if you look up like glucose and fructose concentrations of different sweeteners, and it has like a bar graph to show you, okay, table sugar is 50-50, depending on the high fructose corn syrup, 45-55. Agave, 80-20. I don't know the exact, but you can see exactly how it's broken down. So I think when we're talking about a low carb diet, a low sugar diet, it's important to understand that a carb is not a carb, a sugar is not a sugar, a starch is not a starch. Some are going to be more benign, like less harmful than others. So the ones that we really want to be controlling from a starch and a sugar standpoint are high amylopectin starches, like the white breads, the white rice, the white pasta, because those are going to spike your blood sugar, causing a high insulin response. And high insulin responses will shunt that food towards fat storage. Right? So the amylopectin starches, that's why there's a lot of evidence on plant-based diets, because most of those diets contain a lot of amylose starches, the beans, the lentils, legumes, those kinds of things. And then when we're talking about the fruit, if we can bias our fruit intake towards fruits that have more fiber and less sugar, you're going to be better off from a blood sugar standpoint. So those are like the big macronutrients, right? But what's more important to understand is there's a calorie and there's an insulin response to those macronutrients. And a lot of people are familiar with the calorie model. A gram of fat has 9 calories. A gram of starch has 4 calories. A gram of fiber, more like 2 calories. A gram of protein. Did I say protein already at 4 calories?
Not yet.
Protein is 4, right? So a lot of people are used to the calories, but what about the insulin response? And that's what I want people to understand is a calorie is not a calorie once it's down the hatch, because every single calorie will impact your insulin and your hormones differently. So when we're talking about carbohydrates, because we dug into those first, let's talk about those first. The fiber will actually slow the blood glucose and the blood sugar response of anything else that's in that meal. So having fiber with your meal will help you remain stable with your blood sugars. If you're looking at like a little an arch, the refined starches and sugars, that will spike your blood sugar, spike your blood insulin. When we're looking at protein has a moderate insulin response, but much lower than the carbohydrates. And people might be thinking, well, how does protein cause an insulin response if it doesn't raise blood sugar? Well, there's something called your incretin hormones, which are in your gut. And so that is how protein can raise your insulin levels. But the trade-off is worth it. Because remember, long term, we want to maintain our muscle mass because that's good for insulin sensitivity and it's good for function. You cannot maintain your muscle mass without adequate protein and adequate muscle stimulus. So protein has a moderate response, but fat, even though it's highest in calories, has the lowest insulin response. And that's why when people go on these keto diets, they lose a ton of weight because they drop their insulin levels very quickly. They also get into ketosis, which helps them feel fuller because we know that ketones, which are a byproduct of fat metabolism, help you feel fuller. So the problem, in my opinion, with a keto diet is a lot of people have a hard time sustaining it long term. And so I like to say, well, you can get into ketosis without following a strict keto diet. But when it comes to dietary fats, let's break those down a little bit more before we get into some specific recommendations. So dietary fats, similar to like the umbrella approach with the carbohydrates, the starch, the simple sugars, the fiber, right? I like to say that dietary fats, a fat is not a fat. We start with the trans fats, of course, which were banned, I think in 2018 by the FDA in the United States. Industrial trans fats were banned because they were linked to heart disease. Those would be like the partially hydrogenated oils. They took a vegetable oil that was liquid, they made it solid to improve the shelf life, the texture, the taste of foods. Can't do that anymore. But there are natural trans fats found in ruminant animals in small amounts, and those are okay. So moving our way up are the saturated fats. I won't get too far into the details, but there are short, medium, and long chain triglycerides or saturated fats. So the MCT oils that everyone's crazy about, those are a type of saturated fat. Good for your brain health. Good for, there are benefits to certain types of saturated fat, especially the MCTs. So the long chain triglycerides or the saturated fats, that's most of the saturated fat that people eat. That's the stuff in the full fat dairy and animal products. Saturated fat has long been demonized because it raises cholesterol. This could be, you've probably had a podcast on this about saturated fat raising cholesterol, and is that a concern? Saturated fat will raise your HDL cholesterol. There's not a drug that will raise your HDL cholesterol. HDL cholesterol has been shown to be protective against cardiovascular disease. Saturated fat will also raise the large, buoyant LDL particles that are not as atherogenic as the small, dense LDL particles. So I think that that's a conversation. It's like, okay, well, it raises cholesterol, but is that actually a problem? No. And if people are concerned about their cholesterol, I have a really good video breaking down on YouTube, LDL cholesterol versus LDL particle number. Because what really matters when it comes to cardiovascular disease is the particle number. People can test that with an ApoB test. So they can order it, it's $30 online, ApoB. That'll tell you your LDL particle number. The other thing I recommend people get is an Lp(a) test. And that's something that they can order online as well. That is more of a genetic risk factor for cardiovascular disease and how things might clot and form together. So if people have a high genetic predisposition to cardiovascular disease, I generally do recommend a lower saturated fat intake, not zero, like just lower. Bias your fats towards the other types that we're going to talk about. But some people can eat saturated fats liberally and not have it affect their ApoB levels. The Lp(a), by the way, is not something you need to check often. It's more of a genetic marker, so you just need to get it once. So check your ApoB, eat a bunch of saturated fat, see what happens. If ApoB goes up, then that's probably not a good sign for you. You should lower your saturated fat intake. But if yours stays the same, then you're going to be okay. But regardless, I do believe that people should still bias their fat intake towards some other types of fats that we're going to talk about. So even if you're one of those people that can get away with eating a lot of saturated fat, there's more benefits in other types of foods that have the other types of fats. So there's monounsaturated and polyunsaturated. Okay. Monounsaturated are also known as omega-9 fatty acids. So these are the things found in olives and avocados primarily. That's going to be, those foods are a lot higher in antioxidants, flavonoids, other beneficial compounds than like the butter. I'm not anti-butter. I'm just like, well, olives and avocados have more health benefits than butter has. So I think that's a healthy fat for sure, omega-9s. So the other types would be the polyunsaturated, and this is more nuanced. So we have omega-3 and we have omega-6, polyunsaturated. The problem is that these dietary guidelines are recommending people eat processed omega-6 oils from things like corn, cottonseed, soy over the saturated fats. And you've had a great podcast episode on linoleic acid, which is one of these omega-6 fatty acids, highly inflammatory. And insulin and inflammation are hand in hand. So we can't lower insulin resistance if we're not also lowering inflammation. So if you're eating a bag of Lay's potato chips and it says canola oil or some Pringles chips or whatever, canola oil, soybean oil, all of those oils are going to be highly inflammatory, and I recommend choosing a different option, choosing a chip with avocado oil instead. So from an omega-6 standpoint, those are the things found in the nuts and the seeds. If it's unprocessed, fine, go for it. If you don't have a oxalate, that's a whole nother conversation, oxalates and lectins and all that stuff. But if you don't have sensitivities to those, go for it. Omega-3s are going to be probably even better than the omega-6, but not all omega-3s are created equally. So there is ALA, EPA, and DHA. So all the plant-based folks, if you're eating the hemp hearts, the flaxseed oil, these plant sources of omega-3s, well, there's a really low conversion rate to EPA and DHA, which are the types that are actually anti-inflammatory. So I recommend the wild-caught fatty fish, the blue-green algae supplements. Those are going to be more bioavailable forms of the anti-inflammatory type of omega-3. So I think from a macronutrient conversation, we can't just leave it at a low-carb diet. There's so much more nuance here on, okay, you can eat low carb, but if you're still eating high inflammatory seed oils, if your fats are junk, you're not optimizing your health. If you're underdosing your protein, you're not optimizing your long-term health. So when we're talking about, okay, someone has insulin resistance, which we should probably talk about, well, how do you know? And you covered that a little bit with Dr. Fung, but maybe we can get to that in a bit. But if you know you have insulin resistance, if you have a high fasting insulin, if you have excess abdominal fat, if you have high blood pressure, high triglycerides, low HDL, low energy, frequent carb cravings, those are all signs of insulin resistance. What I recommend is to take a step back and not do anything drastic and realize that you do not want to lose weight if you cannot maintain that, because the weight will come back on. So don't lose weight in a way that you can't live the rest of your life. That's a huge recommendation that I have. So with that in mind, I say start with the lowest hanging fruit for you. And what I recommend is adding the protein and adding the fiber before you start to reduce the sugar. So on our Zivli habit hierarchy, instead of just saying, well, just intermittently fast for 24 hours, or just eat for 8 hours a day, or just cut all the added sugar. Well, it's a lot easier to fast, and it's a lot easier to reduce added sugar if you're properly fueling your body in the first place when you are eating. So that's why I really, really recommend optimizing your protein intake first. And we have an ultimate food guide that goes over all of these guidelines. People can download it for free. They can calculate how much protein they need. We have charts with like animal-based protein and plant-based protein and all the fiber charts that they could need. So if people want some more specifics outside of the podcast, I highly recommend they get that download. So when we're planning out someone's nutrition plan, we have to figure out, what's your goal? Is your goal to lose weight? Is your goal to gain muscle? Most people want to lose weight. So I say, great. From a calorie standpoint, go for 12 to 13 calories per pound of ideal body weight. So if you want to weigh 130 pounds, take 130 times 12.5. That's going to be your calorie goal. Then from there, we're going to figure out your protein goal. 130 grams of protein split evenly across 3 meals to start. If you need a snack, if you're like, I have a really bad snacking habit, fine. Like split it up and add a snack. From there, you can really interchange the fats and the carbohydrates based on your exercise level. The more you exercise, especially intense exercise, the more carbohydrates you can tolerate from an insulin resistance standpoint. Most people I work with aren't exercising that much. And so we recommend a higher fat proportion to carbohydrate. Usually starting around 80 grams of net carbohydrates a day is a pretty realistic amount, 80 to 90. Getting 30 grams, no more than 30 grams of net carbs per meal. That's a really doable goal for most people. Starting there, seeing how you're feeling, seeing how you're progressing. If someone's very insulin resistant, that's probably going to be too many carbohydrates for them. But that's what I recommend is figure out how to fuel your body before you fast. Because the fasting, if you don't know how to fuel your body, it's just a quick fix tool again. And when you stop fasting, the weight is going to come back on. So we have to figure out how do you eat for the rest of your life and then use fasting as an adjunct tool to augment your progress. From a fasting standpoint, I really recommend people start at 12 hours a day because a lot of people aren't doing that, Jesse. A lot of people are having dinner, maybe 6 or 7, and then they're sitting down on the couch, 8 to 9, and they're having some popcorn or they're having some chips or some cheese or some wine. And then they're getting up right first thing in the morning at 6 o'clock and they're putting their sugar creamer in their coffees. Like they're not fasting for 12 hours a day. So create that baseline of 12 hours a day, 3 solid meals. Split the protein throughout the day and you will feel so much better. And then if needed, if you're plateaued, then we can look at the portions. Then we can look at how much fat are you eating. Then we can look at modifying your fasting schedule. But does that make sense, Jesse, from a nutrition standpoint to say, let's not just put a blanket low carb statement on this and call it a day?
If you enjoyed that clip, press here for the full episode. I'll see you over there.
If you have a high fasting insulin, if you have excess abdominal fat, if you have high blood pressure, high triglycerides, low HDL, low energy, frequent carb cravings, those are all signs of insulin resistance. Insulin and inflammation are hand in hand.